The question is, though, when is the time for schools to go back? Because we were told, weren't we, it's going to be a little bit of a delay, a bit of a stagger when we come back after Christmas, just because we just want to make sure that children can be rolled out, the mass testing and lateral flow tests. And then it was schools were going to be closed for a few weeks while we were facing the peak of the winter crisis with the virus. And now it looks like, maybe kids would come back after half term and then possibly Easter. And now the headlines are saying not even after Easter can it be confirmed that children will be back in school. Bearing in mind Easter is the first weekend of April. Easter holidays, you're looking at mid-April. At this rate, the kids will be out for 2 entire terms, added to the extra term and a half they missed last time round. I mean, we are basically looking at kids missing a year in school. So what's the answer for getting them back in? Robert Halfon is chair of the Education Select Committee and Tory MP for Harlow. Good morning to you, Robert.
Good morning.
I have to say, I've been consistent on this throughout. Children should never have been taken out of school. Even back last March, they should have gone in every single day ever since. And I'm horrified by the entire policy. I've been warning people that this was not going to be for the short haul. It was going to be for the long haul. What's your reaction to the news that the government won't even commit to a mid-April return for schools?
Well, I'm dismayed because the Prime Minister said that his intention was to reopen the schools again after the February half term, and that would have still been with kids missing many weeks of school. And what I've done is I've written to the Speaker of the House of Commons, given what's appeared in the media over the last couple of days, to ask a minister to come in to explain what is the route map back to school reopening again, because we are damaging the life chances of our children in our country. Their mental health worries are increasing. There's going to be a loss of educational attainment, safeguarding hazards, and their general well-being. And we have to have some kind of idea when our schools are going to open again, and it should be sooner rather than later.
I mean, when you speak with the government, you speak with the Education Department and Downing Street, which I know you do often, what message are you getting back? Is it that they believe that schools are just terribly dangerous places for pupils, for the teachers, for risk of spreading to the community? Or is it actually that, as certainly what I've been hearing, is that actually they desperately want to have schools open? It's just that the health lobby and the teaching unions are making it virtually impossible for them to be open because the demand is so great for them to be closed. We're told of this risk to teachers, which has not been proven. We're told of this risk to the wider community. Again, we've got no evidence of the virus is going from schools to the families as opposed to the other way round. Where is the pressure coming from for schools to be closed?
Well, this is a very interesting question because whenever I do speak to government, they always say that schools should be the last to close and the first to open, but they've got to mean it. And we had the Deputy Chief Medical Officer to our Select Committee, Dr. Jenny Harris, last week. And she said, and I've always said that I follow what the government medical officer is saying, she said that there was no evidence that even with the new strain, that schools were significant vectors of transmission. She also said that teachers and support staff were at no greater risk than any other profession. Thank goodness. Thank goodness. So what I don't understand is why the government are so determined to keep schools closed longer than perhaps they need to be, because what about the risk to kids' mental health? Do they do the risk assessments? What about their risk to educational attainment? What about the difference between the haves and the have-nots, which we are exacerbating by school closures? We know from the Sutton Trust that, surprise, surprise, those children who are from better off backgrounds are doing much more remote learning than those who are from disadvantaged backgrounds.
There's simply no doubt about that. And it's quite shocking. It's something you and I have been discussing since, goodness me, I think we're talking back in March, April last year. But this is the thing. Has there been any cost-benefit analysis of this? Because we did get a sort of, frankly, a risible pretense of a cost-benefit analysis policy when they went into, I think, the second lockdown back in November. I mean, we're going to lose count of the lockdowns eventually. 2043 and we're in lockdown 47 is kind of where I see our future going right now. But has there actually been an analysis of the cost of sacrificing education, well-being, physical health, mental health, and the futures of and very much long-term health of 10 million children currently in school for the high-risk elderly relatives of theirs who are most at risk from COVID? Because one of the key things that a civilized society does is it does not sacrifice one set of of human beings for other human beings. Every human life is vital, and while we absolutely want to protect the elderly and the very vulnerable, to do so at the cost of absolutely impossible to conceive damage to youngsters seems to me to be an immoral policy, frankly.
Well, I have asked in Parliament, in questions and in debates, for a risk assessment of the mental health and educational attainment on children of schools being closed, and that clearly does not seem to have been done. Now, as you know, I'm not a lockdown skeptic, but I am a school down skeptic, and the schools have been closed for far too long, and we need a route map. And even if you agree with the government measures on coronavirus, well, let's open the schools in the areas where coronavirus is low. At least let's have some kind of timetable. Let's give some hope to parents, to teachers and support staff and children who want to be back in school, that actually there is a timetable, that they will open the schools once conditions are met, and that where coronavirus is lower, we can open the schools sooner.
And what do you make of the claims that actually even the vaccine rollout isn't actually going to change things, because we're told we have to still act as if we have got COVID, and as if we are still at risk of catching it and passing it on. But one of the suggestions being that teachers should go higher up the rankings and higher up the queue to get a vaccine, even though many of those teachers will be young, healthy people, really at very low risk of COVID, certainly in comparison to elderly people and the clinically vulnerable. Do you think that would be the right thing to do, even though teachers are at no greater risk than any other profession?
Well,
if that's what's necessary to get schools back?
I am in favour of teachers and support staff being moved up the list once the clinically vulnerable and the elderly have been vaccinated. And the reason is very simple, is that even though, thank goodness, they are at no greater risk than any other profession, it still means that if a teacher catches the coronavirus, that school children are sent home, and 800,000 children were sent home before Christmas, before we even had the full-on school closure. So if it means that schools can open sooner rather than later, and if it means that there can be no problem from the trade unions who say there is a risk, even though we know, thank goodness, there isn't a greater risk to teachers and support staff, then I think it would be well worth it, because all I care about is getting the children back into school.